Hi, Dr. Anita Haque, back with another tip, part 2, to how to adjust more effectively so that not only is it more comfortable for the patient, but it's also going to be comfortable on your body. So part 2 is, have you ever adjusted blindly? What I mean by that is sometimes what I do when I'm trying to connect with the patient's body, which is what you really want to do. You want to act like you are an extension of their spine, is to actually palpate and work on them with your eyes closed. It can heighten your senses with your tactile touch, and it also allows the patient to feel your warmth, your energy coming through at a deeper level, and that is what you want. It's about the experience, which is going to make the adjustment so much more effective. So I'm going to start working on this wonderful patient of mine here, and I'm actually just going to close my eyes, and when I close my eyes, she may already notice that my touch is different, because as soon as I do close my eyes, my entire focus is all on the biomechanics and the motion of her spine, or the lack of. So just right here, I already can tell she's got a subluxation. So take a deep, deep breath in and breathe all the way out. So great. How'd that feel? Feel okay?
That's good.
So what I'm trying to do with that is, when I had her breathe in, I actually took my hands off of her so that I could let her take that full inhalation in, and she's not going to be tensing up when I'm actually going to adjust her. So that actually helps the patient to have a more comfortable adjustment. Take another deep breath in and just breathe all the way out. Okay, let's get this. Perfect. You got it. Got some good releases there. And sometimes what I do with the patient is, if it doesn't move right away in the first part with them breathing, you just go over it afterwards. You want to go with their breath. You can feel it. And that's why you want to connect with them as much as you can. And then I'm going to get up here and work on her stiff shoulders and neck, because I know she's been working out really hard and she's getting some tension in her shoulders. So just relax your body and there we go. That was a great release for that T1. It's going to help your rib to open up too up there, so you can breathe better. Good. Now I want you to lift your head up for me. This next move that I do with all my patients is to really work on their posture, because we all know how much posture affects the longevity of their life, their health, how they feel, their degeneration. So I always just work on getting right at C5, C6, and just doing a very mild drop on there. How's that feel? Is that painful, or is that okay?
That felt good.
Okay, good. And I just like to traction her spine, and in doing that, sometimes you'll even get a few ribs to release, like you just did, because now the patient's going to be more comfortable. They know that your touch is not going to be harsh. It's not going to be too forceful. So she's already relaxed. A level of relaxation, most of it comes from you as the doctor, not from the patient. Go ahead and come over onto your side facing me. Another tip is, when you are doing side posture, lower back adjustments, you want to make it comfortable for the patient as much as possible, because it is awkward. They're not usually in this position, so you want to make sure that they feel like they're not going to fall off the table. Okay? Yeah, right? You want to make sure you're not going to fall.
You haven't dropped me yet.
No, not in all these years. Take a deep breath and just breathe out. Good. That was it. And I also try to make it comfortable for my biomechanics, so that my longevity is there to adjust for years to come without killing my backs for years to come. And that's why I mentioned in my last video, if you missed it, you want to see part 1, about how to adjust side posture and doing a kick move. So just come right on top, take a deep breath, and now I'm going to connect with her again. That was it. You did very good. Yeah, that was a really, really good one. Okay, we're almost there. I like to end with a really great adjustment for the neck. This is my usual protocol. And same thing, I'm going to palpate, keeping my eyes closed, and I will be able to know exactly where she needs it. And she knows I know, because when I get on there, she can feel it. But as soon as I do get on there, I'm not going to keep a harsh touch, because I don't want her to have her muscle tense up and inflammation to increase. Just relax that shoulder. There you go. So that was a fantastic one. What I asked her to do was relax her shoulder, which got her mind off of her neck and actually allowed me to get in there and get a better adjustment. I'll just do one more spot here. Get this middle part of your neck that also affects your shoulder. Drop this right side. So relax this right shoulder for me. There we go. So simple as that. Sometimes it's just getting their attention off their neck, asking them to do something to distract them can make a huge difference. Now lift your head up for me. I'm going to end with this to improve the posture. And then we're just going to work the cranials a little bit, because having those cranials released, that's the most relaxing part. And we want this to be nice and relaxing. And as a little bonus, I'm going to show you one more adjustment. And this is something I do with her all the time, and it's a shoulder adjustment, just so that it stays open. So a lot of times we'll release the shoulder muscles, do a little bit of stretching with it, get that tendon to open up. And she's so good, she knows to breathe while I do this. And sometimes when patients don't breathe, you're not going to get that flexibility. And she's been trained, she knows. Give me another deep breath, and just breathe out. So this adjustment is a distraction on the shoulder, and then going down, A to P. Okay, so you're going to do distraction and then down. And that's going to help to set the shoulder joint back into place a lot more effectively. Just get all her other spots. Is there any other spots you need me to check?
No, I think you got it today.
Okay, come on up. I'm just going to help you up here. And that's pretty much what you want to do. You want to always ask your patient how they feel at the end, if everything feels comfortable.
Yeah, it does. It feels good.
Great. I'll be back with more tips. I hope you enjoyed it. Keep practicing, because that's what it's about. Dr. Anita Haque. See you soon.